So Achilles tendonitis is basically inflammation of the tendon. The Achilles tendon, which is one of the strongest tendons in the body, and it connects our calf muscles down to our heel bone, has a lot of issues with it. One of the biggest issues, it has a relatively poor blood supply, which makes healing relatively difficult. Some of the most common signs and symptoms of Achilles tendonitis is pain and swelling in the lower leg area with inability to run and push off. A lot of patients have loss of strength. So with most conservative treatment, this involves a course of rest, ice, compression, elevation, and therapy. Most causes of Achilles tendonitis are usually related to actually tight calf muscles. So by going through a good physical therapy course, most cases, again, with time, although it can take 3 to 6 months to get better, can be treated non-operatively. There are a few cases where this becomes a chronic issue that may require further invasive treatment. Some treatment options can range from different injections, such as platelet-rich plasma, to even surgical treatment on the Achilles tendon.